Let's get TMI about vaginas. Can we stop acting like all vaginas just smell like birthday cake? Because spoiler alert, they don't. And they really shouldn't. Hey everyone, I'm Dr. Jen and I'm a medical advisor for Physician's Choice. Today we want to dive into a much needed, no BS conversation about vaginal health. We're talking about odor, discharge, UTIs, anything vagina. Because let's be real, these are the things that all women experience, but no one really talks about enough. So if you wonder, is this normal? Then you're in the right place. So let's get TMI. First, I want to dive into vaginal odor. First of all, if you go into any mall, it seems like everybody wants to have scents, right? They all want things, the vagina to smell like roses or vanilla or some sort of unscented candle or whatever scent that's popular. And that is not realistic. The vagina is a self-cleaning organ and it sometimes has a smell. And you sometimes have a normal smell that's just for you. So what is normal? So slightly tangy, maybe a little musky scent. It can change throughout your cycle. It can actually change after you have sex. It can even change from what you eat. If you're on a keto diet, your smell can be very different. So how do you know when something isn't normal? So you'll notice like a fishy smell, which could be BV. You may notice like almost like a yeasty smell, which could be yeast. And you may have thick discharge. And if it's something that's outside of your normal, then you need to seek professional help. So what causes odor changes? Mostly they're hormonal changes. So it could be pregnancy, it could be some part in your cycle. It could also be that you have recently had an infection, now things are changing back to normal. And sometimes people even notice different smells as they age, even perimenopause and menopause. As you lose bacteria in the vagina, you may actually notice that your scent changes. And that can be because of the different distribution of estrogen, progesterone, and testosterone. So what are some pro tips to kind of helping you maintain a normal vaginal odor? So first of all, you should avoid all harsh soaps and douching. Douching is way out since the 90s. Like, it just makes things worse. You kill all the good bacteria, and really you can actually cause disruption in the microbiome. You should wear loose-fitting cotton underwear, nothing tight, and you should change your clothes like after the gym. If you've been sweating or if you're wearing a bathing suit all day that's wet, you may want to change because that can actually disrupt your microbiome of the vagina. So now let's talk about some of the worst vaginal health advice that I see on the internet, because some of this is wild. So I see things like putting stuff in the vagina, like yogurt to help prevent a yeast or bacterial infection. Don't do that. I see things like putting different products in the vagina. You really don't need to put anything in the vagina. Again, the vagina is a self-cleaning organ. You can use things like probiotics. You can even use probiotics in the vagina or pH balancing gels, but nothing like douches or crazy stuff you buy off of online needs to go in the vagina. The vagina should have a natural pH that's acidic. And so you want to focus on making sure that the vaginal microbiome is supported. So no steaming the vagina and no putting scented things inside of there. There's really no scientific evidence that supports that those are helpful. So let's talk about vaginal discharge. What does your underwear say about your health? Discharge is completely normal. In fact, when you start in puberty, you start noticing that you have kind of whitish or clear discharge in your underwear, and that just continues to get more and more as you age. And it can change throughout your lifetime, the texture, the color, the type. So what is normal? Then clear or white, egg white texture is normal, especially when you're near ovulation. Yellow greenish discharge is typically not normal, could be infection, and certainly thick white discharge can also be abnormal. And any irregular bleeding that's not on your cycle needs to be evaluated as well. This can change in your lifetime, so just remember that if you're concerned, you can always ask. Lastly, let's kind of talk a little bit about urinary tract infections. Peeing after sex is just not enough. You have to focus on having good health of the bladder as well as the vagina. So it's important that you know how urinary tract infections happen. There's normal bacteria in the vagina and the urethra, and when that bacteria that's not supposed to be there, things like E. coli, or there's many other different types of bacteria, actually enter into the urinary tract, maybe after sex, maybe just that you had, again, an abnormal microbiome in the vagina. People who have like BV and other infections in the vagina can actually have urinary tract infections. So the bacteria can go from the vagina into the bladder. And during perimenopause and menopause especially, estrogen levels drop, leading to thinner vaginal tissues, changes in the pH, certainly weaker bladder control muscles, and that can lead to frequent UTIs. And so it's important that you pay attention to your bladder health as well as your vaginal health. So things that can improve it. First of all, hydration. Second of all, cranberry extract has actually been shown to be helpful in preventing bacteria from sticking to the wall of the bladder. So cranberry extract, even combined with a probiotic, things like vaginal probiotic, which is sold by Physician's Choice, is an amazing option for helping to balance the pH, to improve the bacteria in the vagina, and it provides that cranberry extract that I mentioned. So it's important that you pay attention to both your bladder and vaginal health, especially as you age. And I want to normalize these conversations. I want to make sure that you know that it's great to talk about this with openly to other friends. It's good to talk about it to your children. If you're in perimenopause and menopause, you know talking to your daughter who's in puberty is important to get this out there. We need to stop and break the stigma together. So let me know if you have any questions. And certainly thanks for watching the video.